Hi, my name is Lupita Jimenez, and I did my rehab program on speech therapy. Speech therapy is the assessment and treatment of communication problems and speech disorders. It is performed by speech-language pathologists, which are often referred to as speech therapists.
Speech therapy is helping kids and adults learn how to communicate their thoughts and ideas and get their point across so that others can understand them.
Speech-language pathology is versatile. You can work with kids, with adolescents, with adults, with the elderly.
I chose it probably because I had a speech impediment as a kid. I couldn't say my R's, and I know what it feels like to not want to talk, to feel embarrassed, not confident in what I could do. It's true, there's not a lot of males in this profession. A huge population of children with communication disorders are boys, and they seem to respond well to someone who went through the same things that they did, someone they can look up to, someone they can feel comfortable with.
The positive aspects of this job is that you get to see growth. You get to see the results of what you're doing benefiting someone else.
I think in the health professions, a lot of times you kind of have to get in and out and move on to the next patient or client. And with speech therapy, you really get to take the time to get to know who you're working with. You see them on a regular basis, and you get to create that bond.
The drawbacks with working with people is they might not recover like you would hope. And you put your heart into helping them regain their ability to communicate or to swallow. And sometimes they can't or they don't.
You do have to deal with the paperwork, filling out forms for kids who are in speech and keeping up with their progress notes and all of that. And the other negative aspect that I've found is that sometimes there are difficult parents that you have to deal with a bit.
I have found that being a speech-language pathologist, you have to be a really good listener. You would think by the name of my profession that I'm talking all the time. I'm not. I'm trying to get others to.
You have to be able to get along well with a vast group of people from different backgrounds, different cultures, different disorders.
Speech therapy may be needed for speech disorders that develop in childhood or speech impairments in adults caused by an injury or illness such as a stroke or a brain injury. Articulation, a speech disorder, involves difficulties in articulating specific types of sounds. A fluency disorder, which is often referred to as stuttering, it is characterized by primary core and secondary behaviors. Receptive language disorders has difficulty with understanding what is said to them. Expressive language disorders is a communication disorder in which there are difficulties with verbal and written expressions. The National Institution on Neurological Disorders and Stroke estimate that 1 million Americans have some of aphasia. Exercises that help. Word games, pronouncing words. Singing songs help kids a lot. Helpful for children who are working on gaining basic vocabulary. Speech therapy apps. Younger children get engaged more and make it fun for them. Flashcards focuses on the sounds that they have difficulty with. Guess Who helps identify things.
Baby shark do 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 do. Baby shark do 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 do. Baby shark do 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 do. Baby shark. Mama shark do 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 do. Mama shark do 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 do. Mama shark do 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 do. Mama shark. Papa shark do 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 do. Papa shark do 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 do. Papa shark do 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 do. Papa shark.
The amount of time a person needs speech therapy depends on a few things: their age, type and severe of speech disorder, frequency of therapy, treatment of underlying medical condition. Some speech disorders begin in childhood and improve with age, while others continue in adulthood and require long-term therapy maintenance. 7.7% of American children have been diagnosed with a speech or swallowing disorder. A full 4% of adults in the U.S. report having a problem with vocalization. I hope you enjoyed and learned something new out of this. Thank you for your time.